far. I'm Dr. Catherine Yash. I'll be doing the Instagram Live tonight and answering questions that people have about miscarriages or miscarriage risks that put you more likely to develop miscarriage. If you guys see me every so often kind of looking down over here, I have a computer over here where I can kind of track the questions as they're coming through, and I've got someone who's helping me kind of make sure, because this is my first Instagram Live, so please be gentle, guys, as I try to figure it out. I'm definitely not an expert at it. So as people are kind of putting questions in, I'm just going to start by talking a little bit about myself and answering some, questions that have already come up and have been, people have already kindly asked. So a little bit about myself. So I'm Dr. Catherine Yash, naturopathic doctor. I work at Conceive Health downtown. I've been a naturopathic doctor for 11 years. I've always treated patients dealing with fertility, but in the past 5 years, my practice has been primarily focused on treating patients with fertility. So when we were debating doing some Instagram Lives, and everyone was coming with topic ideas, one idea I really wanted to make sure to get to cover was miscarriages and women dealing with recurrent pregnancy loss. So the reason why I wanted to choose this topic in particular is it's something that's very close to my heart. I suffered a number of miscarriages myself before I was able to conceive 2 children. So I know some of the suffering that women go through. Every situation is a little bit different, but I just wanted to let some people know, or anyone else who's suffered through it, that, I've got your back. I understand the heartache. I understand what it's like when people ask inappropriate questions after it's happened or keep checking in with you, and how sometimes, people want to be supportive, but it can be frustrating. So I just wanted to kind of let everybody know that's where I'm coming from. If during this whole Instagram Live, if somebody, maybe you have some questions, but you're not feeling really comfortable sharing, you can always book through like our website. And we do offer 15-minute complimentary kind of sessions where you can at least chat with myself or another naturopath to be able to at least ask some kind of basic questions and go through maybe some of your history, and that's a great opportunity. And of course, you can always book the initial 2 through our website. It's conceivehealth.ca, so our conceivehealthclinic.com, sorry. So you can go to that website and be able to book that way through our online booking portal. So let's answer some common questions that I get about miscarriages. There's a lot of things that come in. Oh, sorry. Sorry. I'm just trying to figure out how to log in so I can connect with my moderator, who's going to ask me some questions too. Okay. Okay. Sorry, guys. Just trying some technical glitches here, so I apologize about this. So let me answer at least some common questions I've got. And I see actually someone already asked a question. What does this mean? Go to a live room. Conceives personal live video. Okay. Sorry guys, I don't know how to do live videos like in this. I'm really not very tech savvy, so I apologize about this. So I'm trying to get this all figured out right now. Anyway, so if anybody has any questions, I think you guys can just send you a request to be in your live video. Hold on, sorry. I don't know what that means. Sorry, guys. So I'll answer some questions that I've gotten before. Okay. Sorry, guys. I'm trying to figure this out. I'm not very good with these things. I don't know how to do this. Okay, I'm just gonna do my best. So if anybody has any questions, there should be a little option to be able to do this. What do we do with this one? Okay, anyways. So let me see if there's a way for me to be able to answer some questions. Okay, sorry guys, trying to figure it out, not working so well. So I'll try my best to be able to answer some questions that you guys have. Oh man. This is not going as smoothly as it's supposed to go tonight. So I apologize for a little bit of the hiccup. So I'm going to answer some questions anyways, and we'll answer some as they come up. And I'm sorry for the technological hiccups that are going on. Okay. Sorry about this, guys. Okay. So women, people, friends, colleagues, everybody who's out there. Okay, so let me answer some common questions that I get as a naturopathic doctor about miscarriages. So obviously the most common is, what does a naturopath look at and how can a naturopathic doctor help with miscarriages? So I think the biggest thing is, when you see a naturopathic doctor, that initial visit that we have is the time where we gather a lot of information. And when we're gathering those details, they give us clues as to the possible reasons a miscarriage could be happening. So when a woman tells me she's had one miscarriage or multiple miscarriages, and the times at which they're happening, that gives me a clue. So if a miscarriage has been before week 10, then I know likely it's a genetic issue. So that can go back to poor quality DNA from the egg or poor quality DNA from the sperm. So those would be things I'd investigate and look at ways to be able to kind of support a woman dealing with that. And also like men. So for a male, where I think it might be poor quality from the DNA from the man, I'll suggest that patient, the male patient, to be able to get a DNA fragmentation if possible. And if not, then I'll treat like as if the DNA is damaged, and give a lot of high antioxidants to be able to protect the eggs and the sperm as they're developing, and make sure that they're better quality. So that's one thing we look at. If it's a miscarriage that happens after week 10, then we tend to think that that's more an autoimmune issue. So then I'll do some higher level questions about, and kind of rule out some of the possible autoimmune conditions that are more specific with miscarriages. So hypothyroidism, hyperthyroidism, both of them can have an autoimmune piece. So if you have either of those conditions, it's worth making sure that you have autoantibodies run, whether through a naturopathic doctor, through your endocrinologist, through your medical doctor, and check to make sure that those autoantibodies aren't present, because if they are, that will definitely cause you to be at a higher risk for having a miscarriage. Some of the other things we look at are autoimmune conditions related to anticardiolipin antibodies, which is a clotting issue. So sometimes we'll run some blood work on that, some initial blood work as naturopathic doctors. Most of the time we have to refer to a reproductive endocrinologist or an endocrinologist to be able to run like a more full panel on that. But I would say if you're having miscarriages and they're happening after week 10, it's worth doing some deeper investigations into that to try to find the root of what's going on with those. So those are some of the things I'll ask. Also, I'll look at a woman's cycle. Is she not having enough progesterone? Is the second half of her cycle too short? Does she start her periods off with spotting before the cycle? Is there spotting after her periods? Because those also clue into different things. So if the cycles are shorter, and in particular the second half of the cycle is shorter, I'm thinking there's not enough progesterone. And when there's less progesterone present, we see that that will cause problems with actually implantation and being able to hold a pregnancy. So a woman who I've seen and she's had a lower progesterone, I will generally try to run blood work before she's pregnant to check her progesterone levels 7 days after she's ovulated. And if she is pregnant, then additionally I will run progesterone during her pregnancy just to check where it is, and either use herbs or nutrients to be able, or even progesterone itself, to be able to bring the progesterone levels up so we can keep that baby and keep that pregnancy going on. So if we see spotting after period, sometimes we think, oh, that could be endometriitis. So an inflammation or infection actually within the uterus or in the endometrial tissue. So that's one for sure. If I hear spotting afterwards, or I hear a woman complaining about bacterial vaginosis, so incredibly odoriferous or smelly vaginal discharge, that points into definitely an infection within the uterus and in the vagina. We look at recurrent yeast infections, also pointing to that again. So there's definitely a lot of things as naturopathic doctors that we go through and look at. And if we see that happens where a woman has recurrent yeast infections or bacterial vaginosis, or has a sexually transmitted infection, or is never well since that, there's definitely some really beautiful tests you can do to look at good beneficial bacteria, like we talked about probiotics, or pathogenic bacteria in the uterus, and making sure to rule those out with some really expensive testing. And we also look naturopathically at using different herbs that are really potent antimicrobials specific for the uterus and the mucous membranes, and good quality probiotics vaginally and orally, boric acid. Like there's a lot of really awesome things to be able to do if there's an infection present, or we think there was a history of an infection present, that can lead you to have problems with implantation and a lot of miscarriages as a result. So there's just some of the initial things my mind kind of checks out. There's a lot more detailed things we look at. Women with endometriosis are more likely, unfortunately, to have miscarriages. And I think that comes back to an egg quality issue, that we see that there's high levels of inflammation present. That means that the quality of the eggs are usually not as great, unfortunately, because you need a lot of beautiful antioxidants around the eggs to really protect them and keep them nice and happy and keep the DNA inside them protected. So when the sperm and the egg meet, then you get a beautiful embryo. So when we see women with endometriosis, because there's so much inflammation present there, and if there's not a lot of antioxidants in the diet or through supplementation, then unfortunately the egg gets damaged, the DNA gets damaged, and then we can't really make great quality embryos, whether even if you're going through IVF, it's the same problem, or natural conception. So that's a big piece with endometriosis. We see a lot of miscarriages. So there were some questions that came in earlier that I want to make sure to address before any other questions come up. So someone kindly asked, can inflammatory foods like dairy cause a miscarriage? So I would say that inflammatory foods themselves would not necessarily cause a miscarriage, but make you more likely to have a miscarriage. So if you have any of those autoimmune conditions we talked about, and even endometriosis is considered an autoimmune condition, any of those that we pile on more inflammatory items on top of, whether we're talking about your diet as being inflammatory, or we're talking about there being different fertility toxins in your environment that are making you have more inflammation as a result. Anything that piles more inflammation onto that will exacerbate that autoimmune condition, and we'll see miscarriages are more likely in those cases. So I would say if you have a history of an autoimmune condition, or you're not sure, that's worth speaking to a naturopathic doctor and investigating. And if you're curious your inflammatory level of a food, you can always do some, expensive but really helpful testing called food intolerance testing, where we don't look at IgE antibodies. Those are the ones that cause anaphylaxis, like we think of kids with like peanut allergies and their throats closing up. That's an IgE, or immediate immune reaction. But what we test as naturopathic doctors is an IgG, food intolerance. And so those are delayed. So you can eat the food, and sometimes the IgG response can take up to 6 hours or even 24 hours to show. So sometimes it can be hard to tell, is that food the part that's bothering me or not? And so with patients who are considering that, or we think that there's a lot of inflammatory problems caused from their food, I'll suggest running that kind of test, and it'll give us a better idea of how much of a reaction is present. So I definitely think it's worth looking into that. And I find dairy, gluten, they can be big issues for a lot of people, and in particular we find that higher rates of miscarriage are associated with patients with Graves and Hashimoto's, and those tend to be associated with worse prognosis when a person is eating a lot of gluten or dairy. So it's something worth investigating for sure if you have a history of miscarriages. Another question that came up is, how does stress play a role? Which is a great question. I would say as naturopathic doctors, we believe stress is everywhere and causes every problem in the body. But regarding fertility, the biggest way that causes a problem is when your cortisol levels peak up in your body, it causes your brain to produce a hormone called prolactin. So that comes out of this right part in your brain here, the anterior pituitary. Your body produces the prolactin, and when you're had a baby and you're nursing that baby, the prolactin is great for making milk. But when you want to get pregnant, it is not helpful, because when the prolactin levels are high, because the cortisol levels are high, we see that prolactin will actually decrease the ability of your body to make a good quality egg. And then what happens is the egg doesn't develop as well. And then you ovulate, you pop it out of the ovary, it goes down to get it fertilized, and then the body's job after that is the part where the egg came out of, called the corpus luteum. That guy there is supposed to produce a bunch of progesterone. But if there's a high amount of prolactin, it causes that egg to not develop very well, and then we don't get a great corpus luteum, and we see low progesterone rates. And if your progesterone is lower in your blood, then we see that it causes problems with not really being able to have enough progesterone to keep the uterine lining thick enough to allow for a beautiful embryo to implant. So even if you get a great embryo, if your progesterone levels are low because your stress levels are high, then we see that that'll cause thinner uterine lining. So whenever I have patients who already we know has existing thin uterine lining, then I will always check progesterone. I'll also look into beta carotene, because that can cause thinner uterine lining, and those will all cause problems with implantation. So that comes back to the stress, because the stress will definitely throw off your whole hormonal pathway and throw off your progesterone levels, which can definitely make you more likely to have a miscarriage then. Is insulin resistance a high risk factor for miscarriages? And if so, what would I do to prevent it? So yes, insulin resistance can put you at a higher likelihood of having a miscarriage. And that's because, once again, it comes back to quality within the egg as well. Like, high levels of insulin will damage, unfortunately, those beautiful eggs or follicles as they're developing. So, and they'll damage sperm. Insulin resistance will definitely damage that. Anytime you have too much blood sugar lying around and your blood can't respond to it because the insulin isn't working, we definitely see big problems then in the body, whether it's infertility or in other parts of the body. So definitely insulin resistance puts you at a risk for a miscarriage. And what I would say is it's worth running blood work. I always like to see where a patient is. So if I have a patient and I'm considering they might have insulin resistance, then I will run their fasting insulin and I'll run their fasting glucose levels. And then I do a calculation to get an idea of how much insulin resistance is really present there. So I think that's an important one to always check if you're concerned about that, whether you're working with a naturopathic doctor such as myself, or you're working with a reproductive endocrinologist or an endocrinologist. You want to know your level of insulin resistance. And then the way we treat that would be looking at things that make you respond better to blood sugar and insulin. So there's herbs like gymnema, there's nutrients like chromium or inositol. We look at making sure that you're on a diet that has a lot more fiber, a lot of good antioxidants, and then also trying to reduce the number of really processed carbohydrates and sugars. So there's a lot of things that we can do as naturopathic doctors to help with that. So if you think there's insulin resistance going on in your body, it's definitely worth checking and working with a naturopathic doctor such as myself to try to get it in control. So another question that we had was, someone asked, after you have a DNC, how long should you expect to bleed? So a DNC is a procedure that's done when a woman has had a miscarriage that's a bit later on, and the actual embryo itself is too large to be processed or kind of passed naturally. Also, sometimes to check the genetic issues, a woman, when she knows she's going to miscarry, her doctors will work with her and they'll suggest doing a DNC to actually be able to test the embryo to look at what the genetic issue was, or if there was one present. So I do think that's always a good thing if you can, and you know, if you didn't know before and you couldn't test before, now you know if you unfortunately ever have another miscarriage again and it's an early miscarriage, I would suggest, you know, talking to your doctor, whether you're working with a medical doctor or reproductive endocrinologist who can order this particular test on a woman who's had a miscarriage. But this is only, it has to be done when you miscarry. You can't do it, unfortunately, ahead of time or in between miscarriages, which is frustrating. But it is worth talking to your doctor if you have miscarried once and it's been early and you're pregnant again. Talk to your doctor if you miscarry again about wanting to do a DNC and testing the actual genetics of the embryo to see if you do end up miscarrying again, if there is a genetic issue, because that gives us a better idea of what's going on for sure. So if you are bleeding after DNC, typically you only bleed for a few days. If you're bleeding for more days than that, like a week, that is something where you really want to reach out to the healthcare practitioner that you're working with who's ordered or had sent you for that DNC, because something's not right if you're bleeding that much. It's definitely something you can talk to a naturopathic doctor about too, and there's things that we can do, whether we do acupuncture to be able to try to regulate the body and decrease the bleeding, but depending on the level of bleeding, how intense it is, and if you have a history of any blood clotting issues, that's something where you really want to work with the medical professional who ordered that particular test. And well, I'm thinking about it since we were talking about acupuncture. I do think it's worth keeping that in mind if you've had a history of miscarriage. From a traditional Chinese medicine perspective, as naturopathic doctors, we use acupuncture and we're trained in traditional Chinese medicine. And the way that in traditional Chinese medicine, the way they look at a miscarriage is to be able to make a baby, you have to take your, what they call your kidney essence, and the kidney essence from the woman and the man is really what makes a beautiful little embryo. And it's the woman's kidney essence who, you have to have a good amount of kidney essence as a woman to be able to support that process. So kidney essence is something you're born with, and as we go about our life and we get busy and we get stressed out and we don't sleep as well and we don't eat as well and we don't meditate, then we utilize our kidney essence, our kidney energy to kind of get us through those harder periods in our life. So as we get older, our kidney essence drops. So from traditional Chinese medicine, one thing that they look at regarding miscarriages and recurrent miscarriages in women is, does that woman possibly have lower kidney essence? And would doing acupuncture to build her kidney yin and her kidney essence really help with that? So I have suggested some patients who've had recurrent miscarriages go weekly for acupuncture, preferably 3 or 4 months, going for acupuncture once a week. Well, we're trying other things to help her get pregnant, just to try to boost up that kidney essence and that yin, because every time you have a baby or get pregnant, that takes a good amount of kidney essence. So making sure to do acupuncture regularly to rebuild that can help. There's other beautiful traditional Chinese medicine herbs we consider too to help with kidney essence for sure. But that would probably be like a big one. Meditating can also really help as well with that. Let me think of some other questions that I get about miscarriages. I would say one thing that I do suggest all of my patients to do is, if I'm just seeing the female partner, I always like to see the male partner too. And the reason why I want to do that is because I feel like, and this is, I'm going to get on a little soapbox here. I feel like the whole fertility world is very focused on the woman and treating the woman, and I think that men they give them such a low bar for what's normal. So one thing I see that comes up frequently is I'll see women and couples with recurrent miscarriages, and it's devastating, and they'll say that the male sperm is normal when they see the morphology or the shape of the sperm is 4%. And I just don't think, how can that be normal? That you could say only 4% of shaped sperm, normally shaped, is okay, and that would be normal? I don't think so. I don't think 4% of normal is good for anything. So I personally like to see, with the sperm in particular, I'll ask to look at the male patient semen analysis, of the male partner in the couple, if there is a male partner, and I'll look over at the semen analysis, and if I see that morphology and I see that's under a 14%, my mind is cluing in that there's a problem there, that these sperm are abnormally shaped. There's not a lot of them that are normal shaped, and that can be a problem, because if the abnormal shape of the sperm is in the head and that's where all the DNA is, and we're seeing miscarriages that are early on, then likely the genetic issue is the genetic material coming from the male partner. So that's where we need to do a lot of antioxidants for the male partner to protect those growing sperm and keep that DNA really healthy. And we give a lot of CoQ10 as well, because for cells to be able to divide and make new good cells and new good DNA, we need a lot of mitochondrial energy to do that process of pulling apart the DNA every time we're doing cellular replication, and bring you back to like old school, science here, and probably maybe high school, where they talked about meiosis and the cells pulling apart. Well, that takes a lot of energy. And if your mitochondria does not have a lot of energy, which as we age, not a lot of us do, then that's going to be a big problem. We're going to make poor quality DNA. So, it comes back to mitochondrial support. Antioxidants for both male and female partners are great. So I had another question. I have a question for today's session. Is it important for TSH to be a certain level during IVF? Yeah, so I would say ideally for TSH, as a naturopathic doctor, I like it between a 1 to a 2.5. And it can definitely cause some issues with implantation. So it comes back to, if your TSH is really high, then that's a lot of signals your brain is sending down to your thyroid to tell your body to produce more thyroid hormone, and your thyroid is not responding. So why is it not responding? Is there some sort of autoimmune case going on that we haven't diagnosed? And if so, you really want to get that checked out to make sure that that high TSH isn't pointing to an autoimmune condition like Hashimoto's, which will definitely make implantation harder. So regardless of where you are in, whether you're going through IVF or considering that, or just, investigating and, trying to get pregnant now, you really want to make sure that that's not going on, and save yourself from, please, some heartache of going through, you know, maybe years of trying and not knowing that there's an undiagnosed autoimmune condition, or going all the way through IVF, then doing a transfer after you've created some nice embryos and not being able to actually see them implant because it's an actually undiagnosed autoimmune condition. So definitely if your TSH is higher, and like I said, as a naturopath, I would like it between a 1 to a 2.5. If it's higher than that, I would want to do more testing to check those autoantibodies and make sure that they're not the problem. There's other things. Sometimes it's just the thyroid isn't responding as well because you're more stressed, or you're not actually utilizing your hormones that you're producing because there's not good iron. And if you don't have good iron and vitamin D, you can't use your thyroid hormone, and low iron will also cause problems with implantation. So there's a lot of things to definitely be looking at. So we definitely have, you know, I don't know if anybody else has any other questions. Please just go ahead and add them into the comments, and, you know, and I'm happy to answer them. And if somebody has a question that's maybe not miscarriage specific, feel free to throw that one out there too. I'm happy to answer kind of any random questions that you have right now about, you know, fertility in general, naturopathic care, how it works. I would say if, you know, financially the money can be tight, and I know it's hard because we're not covered by OHIP, and, you know, you want to check your insurance plan to see if you have coverage for a naturopathic doctor. But I would say if there's one thing that you do, then you really want to at least do that initial visit with a naturopathic doctor. We really try at Conceive Health that at least in the one visit we get someone on a plan that they will theoretically be on for, you know, 4 months to really grow better quality better quality eggs. And then we also look at, 3 months for better quality sperm. And someone asking a question about how much CoQ10 should a male take. Really good question. I would say it really depends. So it's not just about CoQ10 in a specific amount, but actually absorbing CoQ10. So sometimes you want to make sure that a patient's on L-carnitine as well. So I look at all of those things. So it's not just CoQ10 is just going to solve everything. You need to make sure you're actually absorbing the CoQ10. So, you know, higher doses, it's hard to say without knowing the full case, but usually you're looking at least 400 milligrams. I mean, but this is not a prescription because unfortunately you're not my patient right now, and I can't give a prescription until somebody's my patient. But I'd be looking around that territory and considering things like L-carnitine that help take the CoQ10 actually into the cell, so you utilize the CoQ10 you have. And, you know, there's different kinds of CoQ10 that people have questions about. So, you know, if you want to book a visit with a naturopathic doctor, go through that. What's ubiquinol versus ubiquinone? Does it matter? What's PQQ? There's a lot of differences there with CoQ10 too. And I might say, for instance, choose PQQ type of form of kind of a CoQ10 over CoQ10 for certain patients, maybe where I think that there's a problem with like the brain and the production of the hormones in the brain, like luteinizing hormone and follicle stimulating hormone. So I always look at those, and so I don't just give straight CoQ10 all the time. I always look at there's some variability there, and depending on that. And then also absorption is an issue. You need to make sure you're taking it with food. So if you're even taking them all the most wonderful CoQ10 in the world, but you don't take it with food, you're not going to absorb it. So there's a lot of things to definitely consider with that, and the quality of the CoQ10 for sure. Some other questions I'm trying to think. Oh, I was going to say about visits. So let me come back to that. I forgot to finish that whole spiel. Sorry, I like to talk a lot and I jump around a lot. So if you only can do one visit, at least do the initial visit, because we really try to get people on that plan. And sure, I like to do follow-up visits. I really like to cover common fertility toxins that can cause a woman to be more likely to have miscarriages. So things like BPA, things like phthalates, they both are associated with higher miscarriage rates. So that's something you definitely want to look at and pull out of your life, because that will put you at a higher rate of having miscarriages because of the fact that they affect the quality of the DNA. Someone asked a question, what are the best things to do in the 2-week wait period? Yes, the 2-week wait period. It is definitely really tricky to keep yourself calm. And like I talked about, if your cortisol goes up because you're stressed out as you're waiting during the 2-week wait, then that's not going to help for your progesterone. So what I suggest women to do during the 2-week wait is try to stay as warm as possible. Because from a traditional Chinese medicine standpoint, we look at The warmth of the hands and the feet refer to the warmth of the uterus, and a warm uterus means a happy uterus. A cold uterus is not a happy uterus from a traditional Chinese medicine standpoint. So making sure to keep your hands and your feet warm, so that way it keeps your uterus warm from that traditional Chinese medicine perspective. Going for regular acupuncture can help also with implantation. So I do talk to patients about, after, if you've done a frozen embryo transfer or an IUI, coming afterwards for acupuncture. It depends on, frequency and proximity, of course. I try to suggest during the 2 weeks to keep yourself more calm, because acupuncture helps put you in a calmer, mental state too. So that can help with increasing your natural progesterone levels, because we're decreasing the cortisol during that beautiful treatment with acupuncture. So doing that like once a week during that 2 weeks can really help keep you more calm during that waiting period. Also, laughter makes a big difference during the 2-week wait. There's some studies showing that women who, after the frozen embryo transfer, when they spent time with a medical clown and they laughed and they enjoyed it, I personally would not have enjoyed that. But in this study, apparently they did. And they found that those women actually had higher rates of implantation. So I always tell my patients during the 2-week wait, try to focus on joy in your life, watching funny stuff like Friends or hilarious comedies or movies that are funny instead of like the dramas. And if somebody really bothers you and annoys you, just don't call them back for 2 weeks if you can. Try to just surround yourself with people that you love and feel comfortable with, and people who make you laugh, and really trying to do that. And we can also consider, if you're not already on progesterone, as a naturopathic doctor, we can prescribe certain kinds of progesterone, or I look at chaste tree or B6 or GLA that also help increase progesterone. So that's another one too that I consider with patients if they aren't already on that, or maybe they're doing an IUI and the reproductive endocrinologist won't put them on progesterone or those herbs, which they don't do anyways. We do the herbs, but that's another thing to kind of consider doing the 2-week wait. I would also try to eat warm foods with lots of spices added to them. You don't have to go like spicy hot, but lots of spices for flavor, because those enhance microcirculation, so that helps enhance blood flow to the uterus. And the more blood that's going to the uterus, then theoretically the better the endometrial lining and the better nice thick lining there is for an embryo to implant then, or a little viable pregnancy then. All right, anybody have any other questions that I can answer? Maybe somebody thinking anything. Can be miscarriages, can be non-miscarriages. Some exercise then? Oh, some exercises to, like, can you do exercise? Is that the question? I guess I'll answer exercise. Oh, yes. Okay. That's a good question. Yeah. About exercise in the 2-week wait. Yeah. So that's a debatable point. So some reproductive endocrinologists will say during the 2-week wait, don't do anything. Just lay in bed, which is, I don't think, possible. Women get pregnant all the time and they're doing all sorts of stuff. So I'm not a big fan of suggesting a woman do nothing for 2 weeks. I say whatever you were doing before you did your transfer or your IUI, then I would say you can continue doing that within reason. So for instance, if you're doing a frozen embryo transfer, then I would say the day or two after, just take it easy. Don't do anything crazy. You can go for walks if you want. And then after that, I would go ahead and go back to your normal amount of exercise. I wouldn't do like really high intensity interval training. I wouldn't go for a marathon run during the 2 weeks wait. I would keep it a little bit more moderate if you tend to be a little bit more intense with your exercise level. But doing some yoga, going for walks, even going for like a gentle jog, doing a little bit of gentle weightlifting, I think is, as a professional, I would say that's completely fine. Do you recommend NAD for egg quality? Yeah, so NAD is not one that I do as much in my practice. There's a lot of great research on NAD. I just haven't had to utilize it as much, but there is some good research on it showing benefit for the egg quality. So NAD is basically kind of like a specific form of a B vitamin, and there's some good research showing that. And I have a lot of colleagues who use it quite frequently. And as a matter of fact, down at Conceive Health, we even carry some in the dispensary just in case there are those cases where it's really warranted. I tend to go a little bit more herbs, so I tend to use things like resveratrol or green tea, or I'll look at grapeseed, so different things that I consider using for women for egg quality, but there are times for sure where NAD is really indicated. Okay, anybody have any other questions? Anything random about male fertility issues or anything like that? That's one of my favorite things, I think, personally, to work with. For and both partners, I like to also usually my protocol for diets is I like to do an initial with both patients there. I like to do a bunch of prep before the initial, so I've looked through everything. So my protocol is really is geared towards what's actively going on and from the history. And then I like to preferably do like one visit to go through diet, so a second visit to go through diet, and I like to do a third visit to go through environmental toxins, because those play such a big piece, and I feel like they're so ever present. Like when you look at something like BPA, which has been shown to increase your rates of miscarriages highly, and BPA is everywhere with our life, with plastics and everything. So I think it's a good one to go through with people. What has been the most common reason for recurrent miscarriages from your experience? Good question. So I would say, since I see such a variety, there's not one thing that I'll always say comes up. And that's why it always requires so much investigation and questions as a naturopathic doctor, because there's so many possible reasons a woman could have a miscarriage. But I would say the most common one that I see for women right now, I would see is high prolactin levels. So I've seen that quite a bit in the most recent months of my treatment of practice, where women have had either undiagnosed or diagnosed by the clinic high prolactin levels, and that prolactin level is shutting down, like we talked about, the ability to make good quality progesterone. And I've had a number of patients who've seen that as the issue. Like we've noticed that when they do basal body temperature checks, for instance, and they're trying to look for during the follicular phase, the beginning part of your cycle, your temperature should be low, then it should peak up basically for about 3 days and then stay up. And so when you actually don't have good quality progesterone, we'll see in the basal body temperature as well, that temperature goes up and down and up and down. It doesn't stay level. And so that points to progesterone being an issue. And as well as that second half of the cycle will be shorter. Sometimes women will get spotting. And so that has been the problem. If there's just not good progesterone, we can't make a good uterine lining. And so that will mean we can never see implantation properly occur. So we'll see a lot of early miscarriages generally, like usually week 10 and earlier, unfortunately. So that's kind of, I'd say, the number one thing. If you haven't had your prolactin checked, please go get it checked. Talk to a naturopathic doctor, myself, somebody else, work with them, your reproductive endocrinologist, get that checked. What are your thoughts in low ovarian reserve and the ability to conceive naturally? So I would say it's possible. It's harder for sure with low ovarian reserve, because if there's less eggs present, there's less follicles, and so every cycle it's a lot harder. I think it's worth running an AMH, so that gives us an idea of general ovarian reserve, and then I think also it's worth being able to look at your antral follicle count, so doing an ultrasound and seeing the actual amount of follicles that can be taken at that time and utilized to get pregnant. So I've seen some patients where we had to go through DHEA, some patients where we've done herbs to be able to bring it up. So it's definitely harder, and there's higher rates of miscarriages in women with diminished ovarian reserve, and the thought is because there's less eggs and they're possibly less good quality, so we see higher rates of DNA issues and more miscarriages as a result. So I always come back to, with diminished ovarian reserve and less eggs present, we really need to protect the ones that are there. So lots of antioxidants, lots of things like melatonin, vitamin E, things like that. And then I also look at, is there an undiagnosed autoimmune condition that can cause that problem with AMH? Or if a woman has low AMH and that's why they're saying she has diminished ovarian reserve, what's her vitamin D levels? Because AMH is vitamin D dependent. So definitely run your vitamin D if you have lower AMH levels or diminished ovarian reserve. Solution for hyperlactin. Yeah, so there's not one solution for hyperlactin. You have to do a couple different supports. So usually I would say the primary one I use is chaste tree. I use some B6 sometimes. I'll use some things to help with reducing stress levels. But unfortunately, like in this context, I can't give a treatment because you're not legally my patient. Sally, it's frustrating. But I would say work with a naturopathic doctor, myself or somebody else, to be able to, if you've had your prolactin checked and it's high, you want to work with one of us to be able to bring it down naturally. Do you recommend seed cycling? Yeah, I think seed cycling is awesome. I love using seed cycling with patients. For sure. I think that that really helps with being able to moderate the period if it's a cramping or it's too short or too long. I love using seed cycles. Sometimes I combine them with different homeopathics, and I find for some patients it works really well and it's less expensive. I tend to like to do it at the same time that I'm measuring basal body temperature and looking for cervical mucus to make sure that we know when somebody's ovulating, make sure ovulation is happening, and ovulation isn't happening, the seed cycling isn't doing it for them, for bringing on ovulation or being able to modify the period, then I will usually suggest maybe moving on to something more than that, has a little bit more higher level effect, like some herbs or acupuncture, or all use seed cycling at the same time as acupuncture to moderate a period too, or modulate it. I have Hashimoto's. How can I prevent miscarriage? TSH is well controlled. So I would say with your Hashimoto's, you really want to take a look at the level of your thyroid antibodies. And I would say you want to work more specifically with a naturopathic doctor to definitely prevent your miscarriages, prevent a miscarriage from happening. And so what I would say is usually it takes like a good 6 months of being on something like inositol or Rehmannia and heavy desmos. Those are herbs that can help with decreasing autoantibodies. And you want to make sure that your TSH actually is within normal level and it well controlled. Like I said, sometimes our TSH levels are a bit different than medical doctors. So I will say you want to, take a look at that and work with a naturopathic doctor on that. But I would look at that. I would also consider gluten, because that's a factor. We see when women are eating gluten and they have Hashimoto's, they're more likely to have miscarriages. So I would take out the gluten if you haven't already done that, or work with a naturopathic doctor to be able to figure out how to do that, because I know it's not the most comfortable thing, so please don't do it alone. We're always here to help and walk people through it, but I would definitely consider working with a naturopathic doctor and looking at different ways to make your body have more better quality T4 and T3 present, or if you're on T4 medication like Synthroid, make sure that you're actually utilizing it better, and looking at your iron levels, looking at your vitamin D levels, because those can definitely cause a factor for sure. Okay, I've lost 5 pregnancies, but all for different, I'm so sorry. I know how hard it is to lose one, but losing multiple is obviously incredibly frustrating. So yeah, there's lots of different reasons. Like you said, you can lose a miscarriage later on, it can be earlier on. So there can be definitely a lot of different reasons, and women unfortunately can have multiple issues at the same time. And so I'm so sorry that you've gone through that, because that is horrific. I wouldn't wish a miscarriage on anyone ever, and not alone, let alone having to go through it multiple times and not really knowing the one cause and being able to just fix that one thing. But hopefully you're working with a naturopathic doctor already, and they're kind of addressing the multiple causes or multiple factors that are going on. And sometimes as naturopathic doctors, we see connections that sometimes the medical doctors don't see. So if you're not already working with one, it's worth working with one to try to make sure to address as many of those factors as possible, and try to ensure that you're able to have a beautiful child, whether that's through natural conception or through IVF. And, we're, I think, really great at being able to help if there's been issues with egg quality, or the DNA has been not so great and that's caused some of those miscarriages in the past, and you're considering doing IVF, then please work with a naturopathic doctor to be able to do that. 4 months of building better quality eggs and 3 months of building better quality embryos, so that way 3 months of building better quality sperm, so that way you get the best quality embryos, and that way then when you do your retrieval, you pull them out and we see great embryos are able to be made. And then when you go to do the transfer, then I would also consider running things like beta carotene, and also looking if there's been a history of, like I talked about, endometriitis, so yeast infections, bacterial vaginosis, or any of that stuff. We're running, it's called an Emma or an Alice test, or endometrial receptivity, to ensure like everything looks good in that way before you do a transfer, is another thing that I always think about. So I think that kind of covers it for today. I just want to thank everyone so much. Sorry for all the technical issues and glitches at the beginning. So thanks so kindly for all of the wonderful questions, and for everyone taking your time to attend tonight. Oh, you're very welcome. I'm so happy to hear that was helpful. So once again, my name is Dr. Catherine Yash. Are you pulmonary trying to conceive right after miscarriage, or wait? If so, how long? Yeah, that's a really great question. So I would say it depends on the factor that we think caused the miscarriage. So if I think that it's a quality with like the DNA, like it's an earlier miscarriage, then I would suggest possibly waiting 4 months or 3 months to be able to grow better quality embryo or better quality eggs and better quality sperm, so that we theoretically prevent another miscarriage from happening. But it's always a question I talk with patients. I never just say, do this way. I'm saying, hey, this is what I think is best. What do you think? Are you open to it? Let's talk about this. I feel like I work as a team with my patients, and we come up with a plan. So depends on definitely the issue. Sometimes I suggest waiting. Sometimes I say you can keep trying while we're kind of working on everything. But yeah, so thank you so much, everyone, for making time to be here tonight. If you have any more questions for me specifically, please check out our website, our Conceive Health website. You can book a visit with me if you have more questions, you want to do an initial, or you want to do, like I said, one of those 15-minute ones where you can just do a 15-minute complimentary chat, and we can talk about what would I do for your specific case, and then book the initial after. But that's where you guys can find me. So once again, thank you so much for spending your evening with me and asking all these wonderful questions. And I hope that everyone feels like they walked away having some better ideas now of what to do. It's okay, everyone. Have a good night.